This session is entitled Prioritizing and Scaling Up Interventions to Optimize Agriculture, Nutrition and Health Outcomes. We have 5 speakers who will give perspectives. The idea is to try to understand how do we capture synergies between these 3 domains of agriculture, nutrition and health. How do we integrate? How do we converge? What tools, methods, approaches are relevant and useful in different contexts to prioritize what we do, and we, broadly speaking. What do we mean by scaling up, actually, and what are the appropriate vehicles, methods, and approaches for that, again, in different contexts? And because things will differ to a certain amount, we have different perspectives. We have 5 speakers here. There's a slight change from the program. Cheryl Hendricks is unable to be here. Another change is that Kevin Farrell is here, and he's not on the program. But I will introduce the speakers now, and the idea is each one will have 5 minutes to present their perspectives, one after another. Hopefully we then have time for discussion directly after that. The speakers we have are Kevin Farrell, who is the Special Envoy for Hunger from Ireland. Then we have Lawrence Haddad, who's the Director of the Institute for Development Studies of the University of Sussex in the UK. We have next on the list is Venkatesh Manar, who's the president of the Micronutrient Initiative in Canada. And then we have, I believe, Mira Shaker, lead health nutrition specialist of the Human Development Network and the World Bank. And we have Jay Naidu, who's the chair of the board of directors for the Global Alliance for Improved Nutrition Gain. So we'll start with Kevin, and we can go from now. Thanks.
Thank you, Chair. I am certainly delighted to have the opportunity to address this meeting and to briefly set out a few of Ireland's perspectives on this subject. As many of you may know, Ireland has made a very strong commitment in our overseas development programme, and indeed in our whole foreign policy, to the global effort to prioritise the elimination of hunger. Some 20% of our total ODA is now going towards food security, to hunger alleviation, and in particular to smallholder agriculture and nutrition. A special priority in relation to nutrition has of late been to give a strong focus to encouraging the Scaling Up Nutrition Initiative, the SUN initiative, which I'm sure most of you are familiar with. In that context, last September, the United States government and the government of Ireland met together with leaders from the United Nations, from several governments and partners represented here, and committed ourselves to a program of 1,000 days. Again, I'm sure most of you are familiar with that. 1,000 days is a program of action to support the SUN, with the intention particularly to emphasize the particular and absolute necessity to address malnutrition among mothers and children under 2. I thought it might be useful, just simply as a kickoff to this afternoon, to share with you a few brief thoughts on the SUN effort, on the SUN movement, and how, from our perspective, this campaign is progressing. We had a follow-up meeting yesterday with a number of partners, a very useful, I think, a very productive meeting with a number of partners, and I know that some of the colleagues, my colleagues here on the panel, and indeed many of you attended that meeting, but I thought it useful just to bring to this plenary meeting some of the major points of discussion and the conclusions. My apologies in advance if I haven't captured them all. The meeting was all morning and some of the afternoon, so I'm not going to try and capture everything. But for me, the main points from that was, number one, a very broad agreement of the vital importance of ensuring that this movement, the SUN movement, be led by participating countries. In other words, that the priorities and the plans be country-specific and managed by the governments and leaders in the countries themselves. During the meeting, we were delighted to learn of the high and indeed growing level of political commitment in many of the countries, often led by either a head of state or head of government, which has resulted, I believe, in nutrition now being much more centrally placed in some of the governments, and which therefore we have the basis to enable a much stronger interdepartmental coordination, which is essential. I think we would all agree. There's now a strong recognition of the importance of having a fully multi-sectoral approach to nutrition. Very important, the nutrition is now being reflected much more strongly, I feel, in some of, not all, but in some of the national development plans and in poverty reduction strategies, with an emphasis on ensuring that all programs, not just specific nutrition ones, but all development programs have a nutrition focus. But as well as being multi-sectoral, there is an increasing emphasis on an engagement of multi-stakeholders. There was a discussion, therefore, on the importance of involving a very broad range of actors in the nutrition effort. Others have mentioned the role of the private sector. And personally, I feel this is something that is still not as vibrant or as adequately explored as it can and indeed must be. And perhaps Jay on our panel might like to expand on that. I didn't tell you this in advance, Jay, but thought you might. So also, the potential to engage a number of what you might call the non-traditional partners or elements, such as smallholder farmer organizations, trade unions, the media, consumer groups, and of course, very important, the whole civil society sector. Many of the participating countries spoke of the need for building a stronger capacity at all levels, for help in their advocacy efforts and in developing, as was mentioned just now, monitoring and evaluation frameworks. And finally, among the agreements at the meeting, and which I must say I very much welcome, was that several countries committed to begin to develop reference groups which will bring forward the whole process in their respective countries. Of course, there was a good discussion at the end of the meeting on the need for resources and where such resources might come from. Let me just make a couple of points on that. I believe there is a strong commitment and support from several of our donor partner governments, and also, and again perhaps untapped or insufficiently tapped, from the multilateral sector, who are also engaged and can be more so. I believe there's a need for many of the participating governments to continue and even strengthen their own commitments to this process, including the allocation of resources. But I strongly believe that if plans are developed, that if structures for coordination are put in place, and if impact of some of these initiatives begin to be felt, I believe that the resources will inevitably flow. And I can only reaffirm Ireland's commitment to and support for this process. But I believe it's not necessarily about increasing resources. I believe one of the messages from yesterday is that it's more about being more strategic in making better use of existing resources. The kind of things which links to the subject of the whole conference, that is leveraging agriculture, and I might add leveraging education to achieve better nutritional outcomes. And I think with the overwhelming evidence that investment in nutrition is the single most cost-effective development investment. I refer here not to anything that I did, but to what most of you are familiar with, the Copenhagen Consensus, which was a group of eminent economists, not health workers or nutrition specialists, but economists, who concluded, as I said, that investment in nutrition is the single greatest resource and investment that we can make in terms of its return. With that in mind, I would like to encourage participating governments to proceed with confidence and urgency to follow the paths which they're already working on. And of course, I would appeal to all donors and development partners to continue to back up the commitments to prioritize nutrition in their ODA and to give the support, whether bilaterally or otherwise, that this effort so obviously and urgently warrants. In conclusion, let me just say that in Ireland, we are and remain passionate on the whole subject of hunger. I suppose inevitably, in the light of our own history of hunger, its causes and its consequences. So my thanks for the opportunity to share some of these reflections, and I look forward to the discussion. Thank you.
Thank you. Thank you very much, Kevin. I'd like to hand over to Lawrence, please.
Thank you, Stuart. I've got 5 minutes and 4 points. I'm mindful of some things that have been said so far in the conference. I noted Sylvia Matthews' comment yesterday about how agriculture, nutrition, health nexus is complex. I also noted something in one of the parallel sessions today which said, is there a contradiction between this idea of scaling up something that's very complex? My conclusion is that there's no inherent contradiction if scaling up is not simply replication and multiplication in a sort of cookie-cutter way. If it's about adaptation and learning, then I see no potential conflict at all. I'm also mindful of Maggie Catley-Carson's comments yesterday about, she used the language of transition and transformation. And again, I think that's what we're trying to do in this conference and beyond. So my 4 points are related to things that I think are scalable and things that are potentially transformational. So my first point is impact studies. There aren't enough of them. The systematic review that my colleague Eduardo Masset has been doing, supported by DFID, on agricultural nutrition links, looked at agriculture interventions that seek to have a nutrition impact. That's part of their explicit objective. 307 studies were highlighted, published since 1990. Of those 307 studies, only 30 of them had a sensible, sensible impact assessment framework. 30 out of 307 for nutrition. And nutrition broadly defined, not just anthropometry. Of those 30, on a closer inspection, 7 were thrown out because they weren't credible in terms of impact assessment, in terms of being able to construct a credible counterfactual. Of those 23, 13 collected child anthropometry. The ones that didn't collect it, fine, but I just wanted to report on the ones that collected child anthropometry. 13 of those did. 1 of them demonstrated a positive impact on stunting. 5 demonstrated a positive impact on underweight. That's not the end of the story. Of the ones, we were surprised at the low level of positive impacts. So we went back and looked at the studies that had no impact, and we concluded that half of those studies didn't have sufficient power in their experimental design to show an impact if there had been an impact there at all. So the bottom line of my first point is that we're pretty bad at doing impact studies in agriculture that seeks to have an impact on nutrition, and we need to do much better. Second point is relates really to indicators. Is there an easy win by including nutrition indicators in evaluating agricultural programs? If you go to the SPEAR website on the CGIAR website, we did an analysis of every impact evaluation, quite a cursory analysis, but an analysis of every impact evaluation from 1995 to 2008. So it may have changed in the last 2 years. 761 impact evaluations were cited on that site. Only 88 had any outcome indicators, so income, which is odd for a system that says it's about poverty reduction. Only 20 of those 761 had any nutritional health nutritional health indicators. Now, I think for agricultural interventions that have a purpose of reducing nutrition, and they don't reducing malnutrition, and they don't all, but the ones that do, donors and governments should insist on nutrition indicators and sensible impact evaluation plans. Donors and governments and funders have a huge responsibility to do this, a huge responsibility to do this. And I don't really believe the argument that it's really impossible to do this. It's not easy, it's difficult, there are long causal chains, there are lots of indirect effects. But I look back at some of the people in this room, Joachim von Braun, Eileen Kennedy, Per Pinstrup Anderson, Howdy Buis. They led these commercialization of agriculture studies in the mid-80s. And they traced the links through all the different causal chains that you saw in some of the parallel sessions to the impacts on nutrition. It can be done. We've just gotten a bit lazy about it. And if we don't do it, I predict that the current wave we're on now, on the way up, we will have no friends when we're on the downward wave, because we haven't demonstrated the impact on human beings in terms of their wealth, in terms of their health and nutrition status. And I think that's so vital. You heard Michael Anderson talk about the donor appetite for impacts at the human level. Well, we must hold the donors to account to say, if you really care about it so much, fund it. And then we have to also be held to account to actually deliver. So that's my second point, indicators. Third one is sort of a perennial one, but it's when you think about how do you intertwine agriculture, nutrition, and health, I think Pera mentioned it this morning, you have to have a special focus, it seems to me, on women. You have to look at, because they're the ones very often that are charged with these multiple agendas and then making them work. I saw a very interesting study from my old colleagues at IFPRI that was published last year, a systematic review looking at differential access that men and women have to a range of agricultural inputs. So, you know, we at IFPRI, we've been doing this for a long time, but this is the most comprehensive, most up-to-date, best one I'd seen. 50 comparisons across a number of developing countries. Of those 50 comparisons between men and women's access to various inputs, 25 of them showed no gender difference. That's important to note. 25 showed no gender difference. But when there was a difference, it was 98% against women. So what do you do about that? We need to experiment, folks. We need to experiment with quotas, with gender quotas. We need to experiment with all-female training programs. We need to experiment with farmer feedback, because many farmers are women. We need to experiment with farmer feedback mechanisms to evaluate whether interventions are working properly. And my final point is around training. Again, Pera mentioned this morning. It's very difficult. Before I came here, I spent a couple of hours trying to just find some studies that did some content analysis of training programs, master's, undergraduate, PhD programs, that have an explicit focus in bringing nutrition and agriculture together. And I couldn't find any. It was only 2 hours of searching, but maybe you know about them and they're out there. But I couldn't find them. I found a study from Norway, written by a colleague, Anna Oshaug, which said it surveyed 90 employers in Norway and said, what attributes do you want from your nutritionists that you'd like to hire? The top attributes out of 50 attributes were an ability to work with people outside of nutrition, an ability to communicate results effectively, and an ability to communicate just in general. If we had we had programs that delivered those kinds of nutritionists, that would go a long way to helping us intertwine nutrition and agriculture. And I have to be mean to the US. I'm nearly finished here. I have to be mean to the US. I did find a study looking at undergraduate training in the US in agriculture, and it found that only 5% of undergraduates trained in agriculture in the US passed a pop quiz on international agriculture. So what that tells you is that these things don't happen automatically. You have to train people to get out of their comfort zone. You have to have programs that begin to intertwine the DNA of nutrition, health, and agriculture right from the age of 18 or the age of 22. You can't expect this to happen without building that leadership and that expertise very early on in life. Stuart, I'll stop there.
Thank you very much.